As we are all aware, in the last number of weeks and months, the global health is at a turning point. We are all impacted by the sudden USAID Stop Work Order and termination of number of contracts, with a devastating global consequences for lives and health system. People affected by tuberculosis are now being impacted more than ever. It is heartbreaking to terminate projects because of lack of resources and not because services are not needed more. Millions of children, adolescents, and communities are now without access to the essential diagnosis, treatment, and prevention needed most. I have actually witnessed the darkest days as a young clinician in 1998-1999, when access to TB and HIV diagnoses were just inadequate. I struggled to diagnose my patients. I equally struggled to enroll them on quality of care. I even had to manage an MDR patient for a period of 30 months with a combination of different medications. I equally faced significant challenge and heartbreaking for the fact that I had to ration antiretroviral medication for my patients affected with TB and HIV, and even for my staff. At a point in time, we have to take decisions whether to give to patients or to give to our patients affected with HIV who are equally our staff. I actually experienced losing staff, but equally losing my TB patients. Not because their disease are not treatable, not because their disease are not preventable, but it was just because of inadequate access to quality diagnosis and access to quality medication. It was a dark moment. Thanks to the commitment of global donors, including USAID, millions of lives have been saved in the last 2 decades of my career, including many of my own staff and family members. Their support has ensured access to quality, rapid diagnosis, and actually also enabled us to enroll millions of persons affected with tuberculosis, persons affected with HIV on quality care, therefore transforming the entire trajectory on the fight against TB, the fight against HIV, and all other related illness. This success must continue. The dark days must never return. Global leaders, donors, and partners, this is our collective moment to step up. The clock is ticking, and inaction will cost lives. The time to act is now. To our frontline healthcare workers, national programs, and partners, we stand with you in solidarity. Let's unite, reflect, and leverage our collective strength to stay focused on our mission on saving lives. Yes, we can end TB.